Okay, Heather, when you start in Valent, after you log in, you will see this screen, which is they call the dashboard, up here in the upper left-hand corner. Okay?
Okay.
And I'm not going to go over all this stuff now. We're just going to handle how to put in a progress note. I sent you that link to the YouTube video which
Right.
shows how to put in a new patient. This is
Yes.
much the same with some differences.
Okay.
Okay? So, and what I'd like you to do is we're going through this and we can, stop, is for you to develop a step-by-step checklist on what to do. And the idea is we're trying to develop some continuity across providers on how notes are done
Sure.
because um, there's been an issue or two with that. And just if we're going to have a product or service, we'd like to have the product and service be somewhat the same. So I sent you that Word document um, that has the disclaimer on it. Did you get it? You got
Right.
an email this morning, introduction and disclaimer. So
Yes.
always keep that open in your taskbar at the bottom because you're going to be copying and pasting it into every note.
Okay.
Okay? And with VC, as you know, when you open it and you get your person online, you can pin their image to the page so it doesn't keep closing every time that you switch pages. There's a little pin at the top of the image, push pin, and then you can just minimize yours.
Want me to minimize mine?
Well, it doesn't matter. I can't see you anyhow. I minimized yours on my screen. So
Okay.
just so I can have more room to work. But I'm keeping mine up so that when you get the recording, it'll be tomorrow because it has to save to a WMV file and then has to upload to YouTube.
Okay.
But uh, we're going to go through everything step by step. Okay?
Thank you.
Sure.
Thank you.
It's very easy. So the first thing in your checklist is you go to Tools over here on the left-hand side,
Okay.
and I'll try to do this slowly. And then you go to Scheduler.
Mm-hmm. I'm writing this down also.
Sure. That's what I'd like you to do to develop so you don't get lost. The
Okay.
checklist is the easiest way. And once you follow it rote for a few times, and also if you want to practice as we're doing this, later when you watch it, if you just follow, even though it won't change anything, follow my mouse with your mouse, you'll develop that muscle memory so that it becomes easier.
Okay.
So then you left click on Scheduler, and this is not the patient I wanted, so you're going to see something that uh, I hadn't planned. I'm going to delete that appointment. And then I have a so this is something that'll already be in for your appointment when the staff makes it, Therese or somebody makes it, so you won't have to worry about doing this. But I just happened to put the wrong patient in the appointment. So now you see your appointment at 8:30 is training June. Is a test patient that I developed. So what you'll do is you'll right click on the patient appointment.
Okay.
And then you go to document session.
Yep.
And then you go to using mobile notes and left click.
Okay.
And then this will open this screen where you start your appointment. So yesterday for that training video I made for the new patient, I did a note, okay, which is here. So you'll want to review that note before you start, okay? So what you can do is go back. So I went from this choose new plate template for new document, and I just went back to the Valence Suite 6.0 tab.
Okay.
And then you right click and you go down to Easy Nav. And then you go down to Open Patient Chart.
All right.
And then left click on Open Patient Chart. And this will open the patient chart. These clinical decision support interventions will click up every time, and it's really, I mean, tobacco use and screening and all that stuff. I mean, you can find that out in the history. But then to open the patient's initial note or the previous note or any of the notes, you can either look here because they only have one note under intake notes, or you can go up here to documents. And if you click on documents, you'll see the same note. Also, if you want to review the patient's notes before, or any documentation that was sent to the office before the patient was scheduled, then that'll all be listed here too. Okay?
Okay.
So I'm just going to click on this, and then you'll get this dialog box at the bottom that says you want to open this PDF, and you open, and I don't know if you can see the PDF or not, can you?
No.
Okay.
Well, I see a little tiny thing where you can click that says PDF, but I don't see a PDF open.
Okay, so it's just a PDF of the patient's previous visit. Everything that you put in from the patient's previous visit for you to review.
Okay.
Or like I said, if you go up to that Documents tab at the top over here, all the patient's visits plus any telephone notes you might have put in from a call from the facility, or anything that you might have documented in that patient's chart will appear here, and then you can just open it by clicking on the blue link. Okay?
Okay.
And then in the overview, you'll see their billing diagnosis, previous appointments, upcoming appointments, which was today, and then the previous notes, and then their medication lists and allergies.
Okay.
Okay? So we're going to go back to creating the note. So we go back over here from Valence Suite tab to choose template for new document. And you can't see that, can you?
I see the little thing at the top where you're clicking choose template for new document.
Okay, good. All right. Then, so this is a psychiatric progress note because it's not an intake note. And it's not a therapy note. It's none of these things. It is a psychiatric progress note. Okay. So you left click on select.
Got it.
Okay. Then this is important. Go to more details and options.
Okay.
And left click. And click on do not pull prior document data. Because what it's going to do is it's going to fill the HPI section, all the sections that you did on the previous document. And for quality control, we don't want to do that because things may have changed, and if you don't pick that up and change it, then you could have erroneous information in this new note.
Okay.
So you click on do not pull prior document data.
Okay.
And so what that does is just negates that process. And then you go over here to the bottom right-hand corner, and you left click on Start New Document.
Okay.
So it's opening the new document. Now, before you get started with the document, you're going to delete some of these tabs. And I'll show you specifically which ones and why. First of all, there in the new patient document and in this one, there are a lot of these tabs that you will never use. Okay? The software won't let us to permanently get rid of them.
Okay.
So they're just there. So that's what I'm saying. If you practice where you follow my mouse, from one tab to the other, you'll more quickly develop the muscle memory to do this, because that's going to slow you down the most, is hunting where these tabs are until you get about 20 patient visits under your belt. But if you're able to do that beforehand and follow along with this video or the other video and do it, it'll make things go faster. So we're going to go in this bottom row, and we're going to left click on the little garbage can, and we're going to delete this plan med changes. So remove section, we're going to click remove, and this is why. That when you're reconciling the patient's medications, if say, since you last saw the patient, the primary care provider added 20 milligrams of Lasix once a day.
Right.
And you add that into the patient's medication list, then if you allowed this to stay, when you print out the note, it'll look exactly as if you had prescribed that medication on that date for that patient.
Okay.
Which of course you didn't. So
right.
When that's just confusing for the facilities. So we remove that. The second thing is plans lab ordered. Left click, and we want to remove that. And the reason for that is that the facilities have said, and that the surveyors who come in from the state to review our notes for patients have said that they like everything to be simple. So everything we're going to do for the patient, labs, whatever, the next appointment, documenting medication changes, whatever, is all going to be in this plan section. So they know that they just have one place to look for what to do, rather than chopping it up between a bunch of different sections.
Okay.
So we're going to remove labs ordered. And the other thing we're going to do, the last one we're going to remove, is plan next appointment, because you're going to put that in the plan section. Please schedule a medication management for this patient in 1 month, 2 months, 3 months, 2 weeks, whatever it is. Okay? Once again, so that the note is simple and everything that you're doing for the patient is going to be located in this one section. So we remove that. Okay, so now you're ready to start the note. The first thing, so you see here it has the patient's name, their date of birth, your name, the appointment time, and all that kind of stuff. The first place that you go is persons present. And all these tabs are a left click.
Okay.
You left click on that. So persons present in session. The patient, of course, was present. There's the patient's name, and their participation was by video conference.
Okay.
Don't worry about anything to the right of participation.
Right.
Okay? That's all you need. Then you're going to have someone helping you, which the only one that really applies is other caregiver. So it's, say it's a nurse, and the nurse's name is Susan Jones, RN. And then Susan is present also via video conference.
Okay.
And let's say there's a family member there. And it's a son, and the son's name is Robert June, and he's present via video conference. Now, occasionally, you will have a family member who will call in and will be on speakerphone because they want to listen in. They're at work or something and they want to listen in. So in
Okay.
that case, you would select whoever it is, daughter, son, other family, put their name here, and then you would put teleconference.
Okay.
Okay. So now this is one of two areas. If you just leave it like this is not going to be included in the note. Okay, so what you have to do is generate the narrative. There's two places in Valent that you have to do this. So when you generate the narrative, then all that comes down here and it will be included in the note. So if you forget to generate the narrative, of course we're going to go back and check everything before we sign off on it. You know, this information will not be included in the note, and this is essential because it essentially documents that you've actually done a video teleconference.
Okay.
Then we'll space a couple of spaces down, and I'm going into my taskbar, and I'm pulling up the introduction and disclaimer for progress note, which is the Word document that I said to keep in your taskbar all the time. And we're going to right-click and copy it, minimize it again, and then we're going to paste it in here. And that has to be in every note.
Okay. Okay.
All right. So now we're done with that section. So the next section to go to, we're at person's presence. We're going to go across here and go to history of present illness, interval history. So let's say you talk with Susan first. And the way you can do this is sometimes the staff member who's helping you will have the patient with them. And so you can talk to the patient first, depending on the patient's level of cognition or their degree of psychiatric illness. Sometimes the staff member will come in first and go over everything with you. Sometimes, rarely, they'll come in and say, look, do you mind if you talk with Mr. June, I think this is a male, Mr. June first, because he hasn't had his breakfast. And then we can go over all the medications and everything and say, oh, okay, whatever. But in this case, we're going to say that that Susan, the nurse, came in first, and she's going to give us a history. So we're going to do this all in a narrative form. The facilities have told us, and also it just makes sense, is that these folks, you know, it could be an LPN that gets your note to document it. It could be an RN. Either way, their level of psychiatric training is going to be minimal, if any.
Okay.
And they're not going to know our abbreviations and jargon and you know, our special language that we use that no one else is going to understand.
Right.
So this needs to be in a narrative form. And also when the surveyors come in, they may or may not have, you know, we don't know what level of medical training that they have. They certainly don't have psychiatric training.
Okay.
So we want to keep this in a very simple narrative form so that anybody who reads this, even the family members, could understand what happened and why we're doing what we're doing. So we'll say Susan says, since starting the sertraline on the last visit, training has been less depressed and anxious. He is going out to meals and is sleeping better. Whatever she says, okay? And then you can ask questions. Well, is he still agitated? You know, And she'll say, no, he's not really agitated. He is not as agitated.
Okay.
Or it could be the exact opposite. He could be, much worse, of course, So whatever she says, it's just in, I don't even use PRN. I don't use any abbreviations whatsoever because once again, you know, sometimes the families want the notes, which is okay, or sometimes they're going to review them. And
Okay.
also for the surveyors, we just want to keep it in a simple narrative form.
Right.
So Susan goes on and describes what's going on with training, and then training comes in. Training says, in quotes, "Good morning, Randy. How are you?" Um, and you ask him, "How do you feel?" And he says he feels pretty good. Quotation marks. Have you been feeling depressed? He denies depression and anxiety. Everything that he's doing. Do you like going to activities? I like the music activities.
Okay.
And there is a correction here. Okay, so it does all that. Now,
Right.
one thing that that is important to know. Let's say training had a stroke, and his speech is impaired. Okay, or let's say that training is very hard of hearing, doesn't understand your questions, and uh, Susan Jones, the nurse, has to repeat everything to him. So let's say when his speech is garbled because of the stroke, Susan has to repeat everything to you, or it's very difficult to understand. Or training has advanced dementia and is very confused. So that is called interactive complexity. Okay?
Okay.
And that's an additional code you can add to the visit because it's more complicated and takes you longer to communicate with a patient who has interactive complexity. So you would want to add this down here, interactive complexity due to patients uh, speech impairment and advanced dementia, whatever it is. But you have to document if you're going to bill for that interactive complexity.
Okay.
Okay? So in plain English, we have the history of present illness. Now, the son is here, so Robert says, I haven't been here to see Dad much this past month, but he seems to be doing better, or whatever. Okay, so anybody that looks at this doesn't have to have any psychiatric training to basically get the gist of what's going on.
Okay.
Okay?
Yep.
So we go from history of present illness down, say, and what I say is, okay, training, and Robert, what we're going to do now is go over your medical information. So Susan, let's go over vital signs. So right down here are vital signs.
Okay.
And it's all left click. So before you click on edit vitals, remember the patient's height. Because once you have it, unless something pretty drastic happens, you don't need to ask them that again. And that's not something they usually have as part of their vital signs. They have to look that up on another screen or on another piece of paper. So it just slows you down. It's not going to change. So height 68 inches, go down here to edit vitals, type in the height. And sometimes they'll give you the temperature, which is important to pay attention to, and
And where are you getting these vitals from?
From Susan, the nurse.
Okay, so she'll tell you.
She'll tell you. You ask her, okay, let's go over the vital signs.
Okay,
And,
got it.
and 99% of the time they'll have them. Sometimes they'll say, oh, we forgot to get them. Can we go to the medications first? And I'll have somebody take their vital signs,
Okay.
whatever, So they'll give you the vital signs in any order. There's no, some people start off with the height,
Hmm.
165, and then they go to blood pressure,
Okay.
and then they go to pulse, and then they go to respiration, and then you're done. Then many of them will give you the O2 sat, but there's not a field for that, and they'll tell you the temperature, but there's not a field for that. If it's just high, you just say, hey, what's going on, so
Okay.
and then document that. Um, so then we enter vitals and chart.
All
And
right.
then we say, okay, Susan, let's go over the medications and allergies. So just right above here are medications and allergies. It's a left click. And then we go down here and click edit medications. Okay, so the first thing you want to do is review the allergies. So say, Susan, I have that he's allergic to penicillin or augmentin. She says, yep, that's what I have. So you say allergies review. And she said, oh, we've added an allergy since then. He's allergic to sulfa. So you click on, let me go back, I did that kind of quickly. You go back, you go here to manage allergies,
Okay.
okay? And then there's select common allergies, and of course sulfa is a very common allergy. So you can scroll down and click on sulfa, and then add common allergy. Now, almost invariably, they're not going to know what the reaction was. I mean, you know how it is. Somebody comes in and says, well, I'm allergic to sulfa. How long? Oh, I don't know. My mother told me I was allergic to it. So
Right.
they're not going to know the reaction. They're not going to know the date of onset. If they do, great. Oh yeah, last week we gave him some Bactrim and he got really nauseous. Okay, then you can put in uh, nausea, and then the date was June, whatever, 29th, 2017. It's
Okay.
unusual that they would know the reaction and the date of onset.
Right.
So then you add it. So let's say that it's a weird allergy that they're allergic to strawberries. So then you can put it down here in this allergy tab down here where you can just type in whatever you want, and it's going to say, they couldn't find it, just enter free text strawberries as an allergy. And you say yes.
Okay.
You go in, and once again, we have the same situation, and you add it, and now we've got strawberries. And anytime it's free text, it has this little red triangle with the exclamation point indicating that it's been free texted.
All right.
If you say sulfa and they say, I don't have sulfa, or no, we found out that, he's not allergic to sulfa anymore, then you can come over here and click inactivate or delete.
Okay.
But, delete is only used if it's an absolute error. Okay? This is Doctor First, this particular software. It says Valent, but the vendor is Doctor First. So you only use delete if they said, we never had that, and well, I looked, and he's never been allergic to sulfa.
Okay.
Oh, okay. Well, then we'll delete it, or it's safer just to inactivate those
Mm-hmm.
kinds of things. Okay, so now we need to go over the patient's medicines. So starting up here, and then click allergies reviewed, sorry. So you want
Right.
to click allergies reviewed because you have to do that on every visit. Then we're going to go up here to prescribe. And here you'll see a list of the patient's medicines. Okay? And you can click the medications reviewed tab there, and it updates it from when you reviewed it. Now, this is where you prescribe. It's a little deceiving because what you're going to do is they're going to tell you every medication that the patient's on, including PRNs and ointments and all that kind of stuff. And you're going to, make sure that it's in the patient's chart. So you would think that these little check boxes would come in mighty handy because you could just say, oh, yeah, okay, well, we got all those. And got the sertraline, and she says, oh, well, the doctor added another medication. His primary care provider, nurse practitioner, PA, whoever, added Colace, 100 milligrams once a day. Well, you don't want to put it in here because if you put it in here, it's going to actually produce a prescription.
Okay.
And you're not the prescriber.
Right.
Okay. So you go to manage medicine. So here you think, well, I've checked off all these. That's really cool. You go to manage medications, and it still shows you as the prescriber for all these drugs, which you're not. You just can't get around that. But you haven't produced a prescription. Okay. And I put these in on the initial visit. Or the staff put them in when they abstracted the chart. So let's say you're going to add a medication, Colace. Well, I have added, when you sign in the Valent, this should be available to you. I have added, it's not going to show up on this one, I'm sorry. But you put in Colace, you click Find, and there's Colace 100 milligrams. Take 1 capsule by mouth every morning. And you don't need to worry about the quantity and all that because you're not prescribing it. Or you can put in the date it was started if you like, especially important for psychiatric drugs if somebody else prescribes a psychiatric drug. Or if there's something that it's good to have it for all the psychiatric drugs because when you have to do dose reductions, you have to know how long they've been on that drug.
Okay.
So you can put in January 10th, 2000, whatever, 17. And then you click Continue.
I want to ask you real quick. On the little check boxes before each med, the acetaminophen, the amlodipine, and all that, you clicked each box, which took away the arrow there, indicating that you reviewed those.
Yeah, now watch what happens. We're going to go back to that. Back to prescribe.
Okay.
All the check boxes are filled again. So it's useless to use the check boxes because if you leave this screen, when you come back, all the check boxes are filled again.
Okay.
I've written them about this, saying, we have to reconcile these medicines. It would be nice if that didn't happen. So the check boxes are worthless. So my point being that after you do the allergies reviewed, then the easiest thing is to go, you can click medications reviewed here if you'd like, or you can go to manage medications, which can be found here, right above the drug list under prescribe, or it's also found up here at the top. Okay, so you just go to manage medications. Now you just have to remember what the nurse told you.
Okay.
And it's not necessarily in alphabetical order when they tell you.
Okay.
Okay, they can jump all around. So let's say we're doing this and she says, the Lasix 80 milligrams every morning. Oh, okay. Well, you can go over here to the right of Lasix and modify it to 80 milligrams every morning. You didn't prescribe it, you're just modifying and reconciling it.
Okay.
And then it shows up. Okay? So you've gone through, you've made changes, you've added any medications that she has. You're not ready to prescribe your own medication. You're just reconciling her medications that she gave you. Okay. So all that is done, and it's going to be unusual to have somebody with this few medications, but it's a nice thing when they have this few medications, but it's not the usual thing.
No, so, usually they have 20.
Yeah, or more. My record so far is 43.
Oh no. So, wow.
So then we want to get back to the EMR. Okay. So we're going to go up here to the upper right-hand corner, and we're going to click Return to EMR.
Right.
I can hear you just writing this down, and that's great. So we've done the persons present here to the left. We've done the HPI. We've done the vital signs. Now this is a follow-up medication management visit. Okay. So if it's a follow-up medication management visit, and it's been at least 30 days since the last visit, then in order to qualify for a medication management visit, you have to do a review of systems, and you have to review at least 3 systems. So we go from vital signs over to review of systems.
Okay.
So let's say the patient is hard of hearing, here under ear, nose, mouth, and throat. And let's say they have some back pain. And let's say they have some memory loss and anxiety.
Okay.
Now, of course, the review of systems usually comes directly from the patient, but if the patient has dementia, then it's either going to be the nurse. You ask, do they have any pain? Or a family member, do they have any pain? No, they've always had some back pain. Or, if they have dementia and they're on nasal O2, then you can obviously come up here and click chronic shortness of breath.
What about incontinence?
Incontinence, you can go under genitourinary,
okay,
women, men, and then you just have to type it in.
Okay.
Right there. Okay. Now remember, the review of systems doesn't have to be something positive. It could be something negative. So they don't have any musculoskeletal issues.
Right.
Okay. So we checked our 3 areas, and now this is the second place that besides the persons present that you have to generate the narrative, or it will not appear in the note.
Okay.
So you click Generate Narrative, and there you have. So you can see here it says the patient reported.
Mm-hmm.
And of course, sometimes that's not accurate because the patient can't report it because they're aphasic or, have no insight to what's going on. But when you don't have to save this, you generate the narrative, and there it is.
Okay.
All right. And then we just scroll back up, and then from Review of Systems, we're going to go over to Exam. Okay.
Yep.
So these are check boxes. So appropriate dress, adequate grooming and hygiene, assistive devices, could be
walker.
Wheelchair, walker, other, let's say they have, nasal O2, whatever.
Mm-hmm.
Okay, there's one for obese over here. Of course, you're not going to know if they're malodorous. That would be an entirely different technology.
Sure.
They're not going to be disheveled because they're in a nursing home, so. And then behavior, cooperative, intermittent eye contact.
Mm-hmm.
You have a place for dysarthria. If they have speech problems, you can add whatever you want in here, or normal rate amplitude. Mm-hmm. Patient declared is a little anxious, mood congruent, speech is goal-directed, no abnormal. And you've asked them these things beforehand. Are you having any hallucinations? Or the nurse will tell you, yeah, it has some delusions. Thinks, that her husband is in the room, or that whatever the delusion is, paranoid, suspicious, maybe they have impaired judgment, and they're alert and awake. Now, the rest of these are done on the first visit, all these different, or unless there's something specifically you want to check on a follow-up visit. But you usually just stop here at consciousness, because this is a more detailed mental status exam. That's not a usual follow-up.
But on an initial exam, you would do all those things.
You'll see that in the video on the initial exam. We go through that.
Okay.
So, and once again, you don't have once you click them, they're in the note. And then most of these other ones, you're not going to use. So you assessed whether they have no evidence of acute risk or harm to others. If that's not true, then you're going to find that and put most of that in under the HPI. Susan, the nurse, says we walked in and saw training with his O2 tube around his neck and trying to choke himself this morning. Whatever. Okay. So that's going to be up there. But if there is no evidence of acute risk or harm or self to others, this is simple, it's straightforward. There are these other ones in here that are just going to kind of gum up the note. You're capturing what you need, okay? That's what's going on, okay? So let's say you're thinking, well, he said he's still anxious. He's a little bit better with the sertraline, but it seems like, let's see, I'll just add something, maybe he has symptoms of PTSD, okay? So you want an added diagnosis. So you go in right below assessment sources of risk, assessment diagnosis, and then here's that little blue thing like it was under edit medications, edit diagnoses. And here we have generalized anxiety disorder as the first billing. Now, this isn't necessarily the primary diagnosis. It's the billing diagnosis. And importantly, dementia or any other medical diagnosis cannot be the #1 billing diagnosis. It has to be a psychiatric diagnosis like anxiety, depression, bipolar disorder, schizophrenia, whatever. It cannot be dementia.
So dementia is not DSM-5?
It doesn't get paid for your visit as the primary diagnosis.
Okay.
Yes, it is DSM-5, but it doesn't get paid.
Okay.
Okay, so you have to have so down here, you'll see I have unspecified dementia without behavioral disturbance, but it's the second diagnosis.
Got it.
The first diagnosis, which you find here, edit diagnosis, billing order 1, has to be something other than dementia or a medical diagnosis.
Okay.
Okay? So let's say he seems depressed today where he wasn't depressed last visit. So you go up here, upper right-hand corner, and click New. And here's where you add diagnoses. So what I would suggest you do is, as you start to learn these ICD-10 codes, either make a list, or if you have a really good memory and you can just remember that F41.1 is general anxiety disorder. I mean, there's only going to be, 12 diagnoses that you're going to use probably, so it's not a long list. But if you go in here and you happen to notice that, and you can put F32 32.9, and this is the diagnosis you want to use for depression. And the reason is that other diagnoses, F32.9, other than F32.9, can trigger what's called PASAR, which is a more serious mental illness situation that then requires the facility to file extra paperwork and have an evaluation and all this kind of stuff. Okay, so unless that's actually the case, you just use this F32.9.
Okay.
Okay, and so you click on that. All right. And
do you have like a list of the 10 or 12 codes that you use that you
I don't. I've just learned them. Like I said, or if you, let's see, if you don't, you can put in depression.
And that'll generate codes.
Yeah, a long list of them. So, okay. So it's easier. So you can write down now that F41.1 is generalized anxiety disorder and F32.9 is depression. So you have two codes.
Okay.
So, so we're going to put in F32.9 and unspecified depressive disorder. Select, and then we're going to make this billing order number 3.
Okay.
And add it. Okay. So we're done with this section. Now we're going to have to add this under the plan so that the facility knows to add F32.9 as a diagnosis in their chart. So we'll get to that in a minute. So you have to save it. It's the only way you can get out of this. So it's saved. So now we're going to go into plan. So here's the assessment diagnosis. Here's plan. And so the patient may be in the room. The patient may not be in the room. Maybe they got restless and anxious and they had to take them out. Or maybe, you talked to them for 15 or 16 minutes and they wanted to go to bingo or whatever, So, or they could be sitting there. So we're going to say training appears to be depressed. Staff says he is self-isolating in his room. Once again, narrative, nothing, no jargon.
Okay.
So please add, you can do, if you don't remember what the code is, then you can just go back up here to assessment diagnosis and just copy and paste unspecified depressive disorder. Go back to plan and just please add as a diagnosis.
Okay.
Okay. And then we will increase the sertraline as below. So now we have to go back up to medications and allergies. And you've asked Robert, the son, is this okay with you? Here's why we're doing it. It's not sedative. It's a low dosage. So back to the little blue thing, edit medications. So we have to delete the old, or stop the old sertraline prescription. And then, so now you do want to be in the prescribe module. So here's the manage meds, but we're in the prescribe module. So we're going to stop it. And you have to note the date, because sometimes often the software will put a date far in advance when your refills, when you prescribed it, are finished. Okay? So you have to check the date, otherwise it won't stop it. If you put stop it on, it says stop on October 5th, 2017, it's not going to stop it. So we check the date. It's going to be July 4th, 2017. It's not completion of therapy, it's dosage change.
Okay.
And then as I've done these over the past year, I've created my own little list.
Mm-hmm.
So it's dose increase and then stop medication. So we go back to the list and it's still there. So let's see what I did wrong. I had 2018, see,
Mm-hmm.
rather than 17. So I've got to do it again. Dosage change. Dose increase.
Okay.
Stop medication. Now it's gone.
Okay.
So now I'm going to prescribe sertraline. And after you've typed it in enough, it'll just appear.
Mm-hmm.
Or here's where the favorites are. And I have shared these across all the providers that I've created. So this should come up when you get into Valent. So there's a bunch of common ones here that you might just have to change the sig.
Okay.
Okay, so here's, for example, here's sertraline 50 milligrams. Okay, so I can use that, or I could type sertraline in up here. Okay, so if I type sertraline in up here, it's going to come up like this. Okay, if I do it this way, it's going to come up like this. It says 25 milligrams, so, you know, that's better not to prescribe using that drop-down list, but it's good to use if you're adding drugs that somebody else has prescribed.
Okay.
So I just go up here to sertraline. I'm going to increase it to 50 milligrams. Prescribe anyway. Now, so it's the sig is take 1 tablet by mouth once a day in the morning, whenever you want. I'm going to give them a 31-day supply, and I always put 5 refills, even though it may not be, you know, may not keep them, but that way they don't bother you for refills in the future.
Right.
So, and then additional directions to patient for depression and anxiety. And then here, what I do, directions to the pharmacist, so the pharmacist knows what's going on. Well, does he want to add this 50 milligrams to the other 25? Is I'll put dose increase or dose reduction or whatever. And those little things will be created as you create your own.
Just to clarify to the pharmacist.
Yes. And so here we can only add one primary diagnosis, so we'll put depression. You can add a second one if you want, that's okay. And then continue.
Okay.
So then you get the prescription pops up.
Mm-hmm.
And it's got everything we want. We check over it, we click OK. And it appears down here. So the easy thing to do is to copy it. So you can put it in the plan, so you don't have to type all that.
Okay.
And then let's say that there's no pharmacy up here, and you'll get a message, you'll say no pharmacy if you try to prescribe it. Or let's say they say, oh, we changed the pharmacy.
Uh-huh.
So you can click change, and I'll just put in a pharmacy I know, Keller, which is in Ponca, Ponca, there we go, Nebraska. So there's Keller Pharmacy, Ponca. We just click on the name, and then it changes it up here.
So will my system have some pharmacies on there to select?
It'll have, that's just for everybody who has the software. It's like a national pharmacy database.
Okay.
Yeah. So you just have to know the pharmacy, and, you know, so like Omnicare has, you know, ones in Iowa, Minnesota, There's Martin Health. Where are you going to be?
I'm in Nebraska.
So there's Omnicare of Nebraska. There's Martin Health. It might be the local pharmacy,
Okay.
but it'll be in there. But sometimes it's weird because they'll say, oh, it's Bob's Pharmacy. Well, you actually find out it's Bob's You Save Pharmacy in town. So, but they'll just tell you, oh, it's Bob's Pharmacy. But that's
So would it be the nurse or the
the
family member?
nurse, the nurse, the nurse
So
will
she'll
know.
tell me
Yeah,
what
and
pharmacy.
usually everybody in the facility is at the same pharmacy.
Okay.
Usually, not
Okay.
always, but usually.
Very good. So you click the pharmacy name.
And then it just adds it here.
Okay.
So let's say we want to change it, and let's say that it is Martin Health. We'll do Nebraska. Oh, there is no Martin Health in Nebraska, but I happen to know there's a Martin Health in Iowa. Now it's going to pull up Denver, Iowa, Johnston, Iowa, or Storm Lake, Iowa. So you have to ask the nurse that.
Okay.
And they'll know because, like I said, almost everybody's going to be on the same pharmacy. So you just click on the name, and then it goes up here.
Okay.
So we've highlighted and copied the new prescription, and then you'll be given a signature password. And you put that in here, and then you send it. And if there's no pharmacy up here, it'll tell you, no pharmacy entered. Okay. Now, I'm not going to send it because I don't want it to go to the pharmacy. So
Yeah.
I'm just going to put sign without sending just for our purposes. But if I click send, it would go to that pharmacy.
Okay.
Now, let's say you wanted to add lorazepam. So you're going to add 0.5 milligrams, prescribe anyway. That's going to be take 1 tablet by mouth. And let's say you're going to do it twice a day, and they have told you that the patient is more agitated in the afternoon and at nighttime. So you're going to take 1 tablet by mouth twice a day at 1400 and 2000 for anxiety.
Okay. Some sundown.
So, and you're going to give them a 31-day. Now that always doesn't work because unless it's up here twice a day, it's not going to give you the correct amount. So if you put once a day at 1400 and 1 tablet at 2000 here, and you put 31 days, it's only going to give you 31 tablets. So you have to go in here and put in the amount that you want.
Okay.
So you have to go in here and put in 62. And then your refills, and the diagnosis, and then continue. There's the prescription to check.
Okay.
Okay. And here you can copy and paste it again. I'm not going to do that because we're going to do the search related. So here you go and put in your signature password. Now, since it's a controlled substance, it's not going to let you just do it. You have to have triple verification. So when you click send here for lorazepam, it's going to go to this ECPS or EPCS gold.
Okay.
So it's for controlled substance prescriptions. So you're going to click on lorazepam, and you're going to put your Valent sign-in number here. Sign-in password, I'm sorry. Your Valent sign-in password.
All right.
And then you're going to get, I don't know what color they are now, mine's old, but you're going to get this little random number generator, okay? It's magic. I have no idea how it works.
Okay.
But when you press this, a little number will come up here, a 6-digit number, and then you'll put in the PIN, the code from that here, and then this will come up sign and send.
Okay.
And then so now 99.9% of the pharmacies have this. I have one pharmacy out of, I don't know, 50 that don't, and I have to call it in to them.
Okay.
Because they have to pay to have it, but it's highly unusual for them not to have this.
All right.
So I don't want to send this, so I'm just going to exit.
Now, I noticed that you copied the script and you said you're going to put it in the plan. So how do you go from this page back to the plan?
Okay, I'll show you. I'm going to delete this because we don't want this.
Yeah.
Okay, remember when we were reconciling the medications and we went back to the plan, we went back up to return to EMR.
Okay.
So
Got it.
I'm going to go to return to EMR, and then here's our plan.
Okay.
And then we will increase the search alineas below, a couple spaces.
Copy, paste.
Paste. And then what I do is I put the number in here.
Right.
5 refills, and then ERX so that they know that it's already been sent.
Okay.
Okay. Now, so when do you want to see the patient next? Well, maybe 2 weeks, a month, whatever, so please, whatever, usually with a new medication, of course it's better for 2 weeks, but we're just increasing something that we already know they tolerated,
right.
So it could be a month, So
okay.
Please schedule a medication management visit in 1 month and call me as needed. Okay. So now what we want to do is we want to go back and check everything. So we have persons present.
Mm-hmm.
We've got everybody in there. We have the HPI. Read it for typographical errors or syntax errors.
Mm-hmm.
Looks okay. Then review of systems. Do I have 3 at least? Yes, I do.
Okay.
Got the vital signs. Yeah. Exam. I've done all that. Is there anything I want to change that I've noticed as I've continued to visit? No. Assessment, sources of risk. Got that. Diagnoses. I have the diagnoses I like.
Mm-hmm.
And now we're back to plan. Now, before you exit, one last important thing.
All right.
You go up to header and you edit appointment. Now, in order for this to be a 99309 visit, it has to be at least 15 minutes of interaction with the patient. So let's say that you didn't have to prescribe anything, you got on there, the patient said they were doing much better, Susan said they were doing much better, they only had 5 medicines to review, you weren't prescribing anything, you were just going to see them in 3 months, and it took you 12 minutes
Mm-hmm.
out of the half hour allotted. So then you would come in here because it's less than 15 minutes and you would change it to a 99308, which is a low complexity visit.
So are you timing the visit on your watch or something?
Well, I just look down here, on the computer.
All right.
I mean, I know it started at, if the patient was started at 8:30, I know what time it is.
Right.
So,
okay.
Or if it was at 8:05, if I was late or something, whatever.
Okay.
So, and then this add-on code is current medications reconciled. Remember, we had interactive complexity because of hearing impairment and severe or advanced dementia. So here's where you add that interactive complexity code.
Okay.
Okay. And then current medications reconciled. This isn't a charge. It's just that for this visit, you have to document that you reconciled the medications. Okay. And then you save it. All right. So we've checked over everything. If you want to do it a different way, which I've done, but I don't do anymore, you can create the note as a PDF here, and it'll come down to the bottom of the page and say open, and then you can review it exactly like it's going to look. You can't change it, but you can look at it, you know.
Okay.
It's another step. So it's easier just to just go through the things that you have here and do it. So now we're done. So let's say though that you're running behind to the next visit, and you don't have time to finish it totally, or you don't have time to fax it. You can save and close it here and come back to it later through the scheduler, but we're just going to sign and close it.
Okay.
So signing this document will prevent any further editing. Do you wish to continue? Yes.
Okay.
Okay, so now we're back to the patient's chart that we had opened because we opened that intake note. Now, in order for the note to be saved and for the visit to be completed, the last thing you have to do for that to happen is to refresh. Over here on the left-hand side, you have to refresh the page.
Okay.
That's important. It's not going to work unless you do it.
All right.
So everything's refreshed, but the patient's note isn't up anymore. So you have to go back to the scheduler. So you go back to Tools, Scheduler, left click, and now the note is smaller because it's a 99308, not a 99309, so it didn't take up the whole half hour as it was originally scheduled. Okay, so it truncated. So we right click on it, because that's where you go to, that's how you get to, you know, document session, but we've already done that. We did the mobile notes. Now, if the computer gets interrupted or something, you can go to document session, and down here it'll say continue with mobile notes, and hopefully it'll have saved everything that you've already put in, and you can just continue.
Okay.
But for this, to send the note, we want to go to Easy Nav, Open Patient Chart. Once again, all this stuff pops up. And then you can see our new progress notice here. We don't want to open it. We want to go to the top to Documents. And then we want to click on the most recent note. So here's 7-4, Progress Note. Click on that box. And then we want to fax it. So let's say this is one of my facilities, the Elms. And I'm going to send it to Susan Jones, RN, include cover sheet, and what we want to be nice, because remember, the facility is your client.
Right.
So thank you, Susan, Randy. And then I'm not going to do it because it'll actually send it, but
right.
Click OK, and it's gone.
Okay.
99% of the time it goes through okay. Sometimes you'll get a text or a call back from, and that's why I give all the facilities my phone number, not only to be on call, because once again, that's your responsibility to them as a client and to the patient, but also if they don't get the note, they'll text me and say, hey, I didn't get the note on training from today.
Okay.
So, and sometimes this fax software is kind of clunky, rarely, but sometimes it does, the fax doesn't go through, so you have to come back in, open the patient's chart, and resend it. So we click OK, and then it'll say save successful up here, and the note is gone.
Okay.
Okay, and then you can close out of this, and then you just go on to the next patient. And here we have, we'll just close out of the original notes that we opened at the bottom. And then hopefully you have the rest of your schedules full and you go on.
Mm-hmm. Well, I have a few questions if you don't mind.
Go ahead.
You know, I know I've got a lot to learn, and I'm going to be practicing with the video that you sent me and these different things.
And I'm going to send you this one too. It'll just be tomorrow because it takes like an hour to upload it, to save it to a WMV file, and then it takes an hour at least to upload it to YouTube. I'll send you the link tomorrow.
Thank you very much. I really appreciate your help, and I took a lot of notes. I think what would be helpful for me, if you don't mind, is I'd like to review the videos and practice over the next couple days on my own. Now, would it be possible for you to check in with me Wednesday evening? Would that be possible?
It would be better for me, say, what are you doing on Friday?
Friday I work until like 4, and then it takes me maybe almost an hour to get home, so I'd be home by 5-ish, which would be, what, 3 o'clock your time?
Yeah, the only thing is, it'll be 2 o'clock. The only thing is in the evening, you know, I'm here Thursday night. I have to teach a class to Psych NPs at Azusa Pacific University on telepsychiatry.
Okay.
For 3 hours, and then you know Wednesday I kind of go out to dinner with my daughter and her family, and that kind of stuff. Friday would probably be better for me, or maybe you know, I'll be traveling on all day on Saturday, maybe Sunday or Monday evening, because you start when?
I start Monday.
Start Monday, so maybe let's just touch base and see what's going on Friday, or maybe Monday.
Okay. Do you want me to?
I'm going to stop the video. Hold on a second. Do you have any other questions relevant to Valent that I need to keep this open so you can see?
No.
Okay.
No, that's okay.